Amazing. So thank you so much again for the invitation. I am Sarah Horn, Director of Education and Training and Global Speech and Hearing Lead at SmileTrain. Today we're going to be talking about advancing safe surgery through innovation and simulation for strengthening the cleft care workforce. So I'm excited to share more with you about how SmileTrain and Simulare Medical, a division of SmileTrain, are working to expand access to safe, high-quality cleft surgeries through innovations in training like surgical simulation. And again, grateful to the G4 Alliance Innovation and Technology Working Group for this invitation. All right, so as this group of all of you stakeholders and advocates knows very well, globally we're facing a significant surgical access gap. An estimated 5 billion people still lack access to safe surgical care, and this burden falls disproportionately on low and middle income countries. A major driver of this gap is the shortage of trained surgical providers, and in many surgical settings, there simply aren't enough surgeons, anesthetists, or trained teams to meet the need. And at the same time, there are persistent disparities in training opportunities and infrastructure, which further limits capacity. But as we know, access to care alone isn't enough. Expanding surgical volume without ensuring quality and safety can lead to poor outcomes. And safe surgery depends on having skilled, well-trained providers. We know that surgical outcomes are directly tied to training and experience. So if we want to scale safe surgery globally, we also need to scale and innovate in how we train the workforce. So a focus on cleft care here at SmileTrain. Cleft lip and palate are among the most common congenital conditions globally, affecting about 1 in every 700 births. And cleft surgery is highly effective, but it is also very technique sensitive. So small differences in surgical approach can have a significant impact on patient outcomes. At the same time, many providers, particularly in lower resource settings, may have limited exposure to cleft procedures during their training. And that makes achieving consistent, high quality outcomes even more challenging. So, what's really important to emphasize is that the impact of a surgery goes far beyond simply closing the cleft. Surgical timing and outcomes affect a patient's ability to speak clearly, to eat and maintain proper nutrition, to hear effectively, and to fully participate in society. So when we talk about cleft surgery, we're really talking about long-term function and quality of life. The quality of those primary surgeries, the cleft surgeries, really play a critical role in shaping outcomes over the patient's lifetime. And research consistently shows that surgical technique and surgeon experience are key drivers of those patient outcomes. So a bit about SmileTrain. SmileTrain is the world's largest cleft-focused organization with a global footprint spanning more than 75 countries and over 1,100 partner hospitals. Since 1999, SmileTrain has supported more than 2 million cleft surgeries worldwide. And this work is delivered through a network of over 20,000 partner professionals in low and middle income countries, surgeons, anesthetists, nutritionists, speech therapists, and more. And they're all providing care within their own communities. Importantly, SmileTrain does not just support surgeries. We support the full spectrum of comprehensive care services that are necessary for cleft-affected individuals. So in addition to surgery, that includes feeding and nutrition support, speech therapy, orthodontics and oral health, ear and hearing care, and psychosocial support, all of which are essential for achieving strong long-term outcomes in this population. At this scale, SmileTrain is not only delivering care, but we've been able to build a global platform for capacity building and the introduction of training innovations like Simulare Medical, which we're going to speak about today. And what really differentiates SmileTrain is our model. Some of you may know, but our model is centered on local empowerment. So rather than sending external teams in to these low resource settings, SmileTrain partners directly with local hospitals and providers, funding and supporting surgeries delivered by those teams, and investing in the education, training, and infrastructure needed to strengthen those health systems from within. This approach enables continuous year-round care rather than intermittent surgical missions. And by investing in local providers, it also allows for exponential growth in access to care over time. Training is truly a key part of our model. Our motto is teach a person to fish. And in 2025 alone, SmileTrain supported a total of 1,856 medical professionals to receive nearly 38,000 hours of training across cleft care disciplines. So we're very proud of those numbers. And ultimately, the result of this model and this work is sustainable long-term impact. So we're seeing earlier access to cleft surgeries, more patients reached with comprehensive cleft care, and ultimately better outcomes, along with stronger, more resilient local health systems. A data point we are particularly proud of in the bottom right, you'll see the patient age at primary cleft surgery by percent. So the optimal timing of this surgery being done is before 18 months of age. And looking at SmileTrain data from 2001 all the way through 2026, you can see that the age at primary surgery has decreased significantly, with nearly 50% of primary cleft surgeries conducted at 5 or more years of age in 2001, and that number now down to less than 20% globally within the SmileTrain network. But even with this model and scale, critical challenges remain, including the question, how do we ensure that providers have consistent access to high-quality surgical training? As you all well know, there remain persistent challenges in how surgical training is delivered, and this is true in cleft training as well. In many settings, trainees have limited case volume and exposure to cleft procedures can vary widely. In some cases, surgeons may perform very few cleft surgeries before practicing independently. At the same time, access to structured and cleft-specific skills training is often limited, and programs may face constraints in faculty, time, resources, and more. And as a result, training pathways can be inconsistent, and opportunities for repeated practice in these cases may be limited. Because of these gaps, much of cleft surgical skill development ends up happening in the operating room. And while that's an essential part of training, it also means that learning often occurs on live patients, where there is very little margin for error. Opportunities for feedback and supervision can also vary in this setting, and it's difficult to standardize the learning experience across different settings or across trainees. So altogether, this contributes to variability, not just in how cleft surgeons are trained around the world, but ultimately in surgical technique and in patient outcomes. So let's talk about simulation as a solution. Simulation-based training offers a practical way to address many of the challenges we've noted that are present in surgical education. It allows surgeons to practice without risk to patients, and importantly, to repeat key surgical steps multiple times, something that's often difficult to achieve in clinical training alone. Simulation also creates a more standardized learning environment and enables structured and individualized feedback, which can support more consistent skill development in surgeons. There's also strong clinical evidence behind the simulation training approach. Across surgical specialties, simulation has been shown to improve technical performance, increase confidence, and better prepare surgeons for the OR. So overall, simulation helps to fill critical gaps present in traditional surgical training pathways. And that's where Simulare Medical comes in. So Simulare Medical is a division of SmileTrain. It was acquired in 2020 to expand access to high-quality, innovative surgical training across our network of more than 75 program countries. These are high-fidelity cleft surgical simulators. They were originally developed by a cleft and craniofacial surgeon, Dr. Dale Podolsky, out of Sick Kids Hospital in Toronto. And they were developed in a response to a clear clinical training need. You'll see Dr. Dale Podolsky there in the bottom right. He's leading a Simulare Medical workshop recently on our new speech surgery simulator. So the models, our Simulare Medical models, are 3D printed and procedure specific. They are designed to reflect real surgical complexity, including variation in anatomy, and are multi-layered to mimic real tissue handling and provide realistic visual and tactile feedback. Our simulators are also life-size and anatomically precise for the pediatric population, which helps ensure that training closely reflects real operative conditions. So our Simulare Medical simulation system is built not just for one-time use, but for repeated training across workshops, skills labs, and formal training programs. Simulation in practice. Simulare Medical simulators are used in hands-on training settings. Surgeons participate in workshops with faculty guidance, from small group training within a fellowship or residency program to larger group training at conferences or boot camps, where trainees can practice critical steps of cleft procedures in a structured environment. And they can receive direct, individualized feedback and have the opportunity to repeat and refine surgical techniques, something that's truly difficult to do consistently in the operating room. So this allows learning to happen before surgeons are ever performing these procedures on patients. All right. Through SmileTrain's global network and institutional partnerships, Simulare Medical has been integrated into training programs at scale. These models are used across workshops, courses, and fellowship programs, supporting both surgeons in training and those continuing to refine more advanced cleft procedures and techniques. Our Simulare Medical portfolio spans a range of cleft surgeries, from foundational procedures like unilateral lip repair to more complex secondary interventions, including alveolar bone grafting and speech surgeries for velopharyngeal dysfunction. Importantly, these tools are supported by evidence. Multiple clinical studies, including publications in plastic and reconstructive surgery, have demonstrated improvements in surgical skill, confidence, and readiness for the operating room following training with Simulare Medical simulators. And since 2020, more than 7,000 surgeons have been trained worldwide with Simulare Medical, and over 20,000 hours of surgical training have been delivered across more than 40 countries. But the question remains, how do these trainings truly impact the surgeon's skill development? Well, over 95% of our trainees report that simulation training through Simulare Medical will improve the quality of cleft procedures they perform. So together, this highlights the potential of simulation to expand access to high-quality surgical training at scale and ultimately improve surgical outcomes for our patients. In the end, the goal of all of this work is impact, both on the workforce and on patient care. From a workforce perspective, simulation training helps accelerate skill acquisition and improves readiness for independent practice. It also expands access to the training beyond high-volume centers and into lower resource settings, helping to grow the number of trained providers in the areas that need them most. From a safety and quality perspective, this translates into better prepared surgeons entering the operating room, greater consistency and precision in technique, and stronger adherence to best practices in cleft surgery. The broader literature supports this, showing that simulation is associated with improved technical performance. So together, these factors are contributing to safer surgery and improved outcomes for patients worldwide. All right, so let's get into a bit of a short case study here. We know in low resource settings, a surgeon may only see a limited number of cleft cases each year. And here we have a 1-minute video where we'll hear from Chief Resident Dr. Stephen Gichuru at the University of Nairobi on how simulation training is supporting skill development for surgical residents across Africa. And Jeannie, let me know if you can't hear, but hopefully it will be fine.
Hi, my name is Steven Gishuru. I'm the chief resident. So currently we are having a Cleft Simulare for the past 2 days, where we go through the common techniques in cleft lip and palate repair. So yesterday we did the cleft lip, both unilateral cleft lip and bilateral cleft lip. Today we are doing palatoplasty. So the residents are really benefiting. We have all the residents from first all the way to fifth year currently attending the Simulare. And it's practical. We have specimens with us, silicone specimens where we can practice the markings as well as do all the surgical steps.
So we are very proud to be partnered with institutions like the University of Nairobi, where we can support with integrating innovative training tools like Simulare Medical into their residency curriculum. And further than technical training, we've even seen these innovations spark interest and draw surgeons in training and general surgeons to the cleft specialty, making an even deeper and longer term impact on the cleft care workforce. All right, so this model works because it brings together two key elements, one being strong local partnerships and the other enabling technology. First, on the partnership side, training is delivered locally through universities, professional associations, regional conferences, and SmileTrain-led workshops. By building on existing infrastructure, we're able to deploy training quickly and sustainably across regions. And this model also supports peer-to-peer learning and mentorship, which are critical for long-term skill development and allow the model to adapt across very different health system contexts. At the same time, as we've discussed today, technology and innovative training tools are helping address many of the limitations of traditional training. They expand access to high-quality training, reduce geographic and resource barriers, and decrease reliance on variable case exposure. These technologies also help to standardize training across settings, which is key for consistency and quality. So together, partnerships and innovation are creating a model that aims to be both scalable and equitable. This innovation work from SmileTrain and Simulare Medical is continuing to evolve across multiple areas. So on the physical simulation side, we continue to expand our portfolio of Simulare Medical simulators to cover a wider range of cleft procedures and presentations, including our newly launched speech surgery simulator, which supports development of more complex surgical techniques. At the same time, we are focused on reducing manufacturing costs and continuing to improve the usability of these models through ongoing research and development. We're also working on evolving how training is delivered. So, for example, exploring how to effectively support remote simulation training with live feedback, which would add flexibility and expand reach. But we also recognize the limitations of physical simulators, particularly around cost, manufacturing, and logistics. That's why SmileTrain has also invested in innovation through digital training tools. These investments are designed to address some of the key limitations of the physical models. So in partnership with BioDigital, we've developed the SmileTrain Virtual Surgery Simulator, which you'll see in the middle photo on the right. And this application provides 3D interactive anatomy, lectures, and surgical videos for learning via a simple smartphone app. We've also developed a virtual reality operating room or VR/OR application, which immerses surgeons in a metaverse operating room, enabling real-time practice of cleft procedures and surgical techniques on virtual patients. This VR/OR app also supports multi-user sessions, enabling our trainers and trainees to learn together remotely from anywhere in the world. One of the more exciting developments is the integration between these training platforms. So we've actually created a digital replica of our Simulare Medical physical models within the VR environment, which you can see on the top right. And this allows for trainees to practice procedures virtually in this VR/OR before even transitioning to physical simulators. So really creating that training continuum. We're also beginning to see emerging evidence supporting these training approaches, including a recent study published in PRS where surgical trainees received live instruction through VR across continents. Together, these efforts and investments are about diversifying training approaches to improve access, scalability, and long-term sustainability. As we've said, it is important to acknowledge limitations. Our Simulare Medical high-fidelity models have a level of detail that can make them more complex and costly to make and to scale. So ensuring affordability and access remains a key focus for us. We're continuing to expand distribution of these simulators through our partner network, improve logistics challenges that come with physical simulators, and explore ways to make these tools more accessible. And as a global NGO, part of our role is to invest early to de-risk these innovations and to build the evidence needed to support broader adoption. So we are approaching this from multiple angles, including supporting longer-term training pathways through investments in multi-year surgical fellowships and university partnerships, like our partnership we referenced earlier with the University of Nairobi. Ultimately, this work comes back to impact. So training is foundational to safe surgery, and simulation helps to fill critical gaps in how surgical skills are developed. Innovation allows us to accelerate workforce development, and partnerships make it possible to scale that impact sustainably. But most importantly, this matters for patients. The outcome of a first cleft surgery can affect speech and development for life, while revision surgeries are often more complex and less accessible. So scaling safe surgery requires investment in people, training, and innovation. And at its core, investing in training is investing in safer outcomes for our patients. I thought we could end with a quote from Dr. Roberto Flores out of NYU. He says, Simulare Medical simulators create a safe training environment where surgery can be performed, mistakes can be made, and learning happens alongside experts, fostering safe, reliable surgery. So we would love to connect with you. Feel free to reach out to us, follow us on Instagram at Simulare Medical. The QR code here will take you to our website if you'd like to learn more about our work. And I can also share a link in the chat for any of the other resources referenced as well for your use. So thank you so much. I am going to stop sharing and I'll pass it back to you, Jeannie.